Hello, everyone. It's an honor for me to be part of this year's annual BC Lupus Society Symposium and share my talk, Reasons to Take Medications as Prescribed, the latest research from Arthritis Research Canada. So I'm coming to you from my office here at the University of British Columbia. So I want to take pause to acknowledge that UBC is situated on traditional, ancestral, and unceded territories of the Musqueam Nations. And I invite you, wherever you are joining us from, to take pause and acknowledge the people and the land that you're on. So I am proud to be a long-term friend of the BC Lupus Society. And as I did last year when we couldn't physically be together for the symposium, I thought I would share some oldie but goodie pictures from prior BC Lupus Society events. So this was from the BC Lupus Gala in 2015, where the baby in the belly is now the little girl holding the orange balloon from the BC Lupus Walk in 2018. And I do look forward for the future opportunity to be together at a future BC Lupus Society event. So I am an associate professor at UBC and a research scientist at Arthritis Research Canada. As an epidemiologist, I do research that focuses on how patients can better manage and live with chronic disease. And one area that I work on is medication adherence, that is helping patients with taking their medications as prescribed. So I'm grounding my talk in lupus medications, particularly hydroxychloroquine, which is the cornerstone of management of lupus, because it is recommended for lupus patients to control disease activity, to reduce flares, and to prevent damage. How I'll be presenting the research today is first I will be presenting what that headline is. So, what was the topic of the research? And then I'm going to provide a little bit of a summary about how we did that research. And then importantly, what we learned from that research. So the first one is actually an old study that I did. This was back from 2017. And what I did first is conduct a systematic review of medication non-adherence among patients with lupus. So how we did that is research the medical literature for all studies that looked at this particular situation. And altogether, we found 11 journal articles that studied how patients with lupus take their medications. And when we pulled together or synthesized those findings, what we found was 43 to 75% of patients do not take their medications as prescribed, which is quite alarming, which then set the stage for the next round of research for us to look at ways, to look at reasons to encourage patients to take their medications as prescribed. So one study that we did, and this is actually hot off the press, just published this year, a PhD student, Rashid, looked at does taking antimalarials as prescribed, so this adherence to antimalarials, does that have a mortality benefit? So how we did that research? So we took medical records of British Columbians, including doctor's visits, hospitalizations, and deaths, and filled prescriptions. And we followed 3,062 patients who were taking antimalarials. And then we looked at whether they were taking them as prescribed. So they were looking at their adherence. And we did this over 6.4 years of follow-up. And what we found that those patients that took their medications as prescribed had a 71% lower risk of death. So when you think about the pathway to that, so going back to my original slide of hydroxychloroquine being prescribed to lupus patients to control disease activity, to reduce flares, to prevent damage. So here the pathway is when taken as prescribed, you are getting these medication benefits, and that is leading to better survival. So this is another study that we did. Again, look at a potential additional benefit of taking antimalarials as prescribed. This was also done by a PhD student, Sharzad. So what she did this time was to look at, do patients that take their antimalarials as prescribed, do they have a lower risk of developing type 2 diabetes? So we use similar methods of looking at medical records of British Columbians living with lupus. And this time we were able to study about 1,500 lupus patients taking antimalarials. And again, we looked at how, their prescription patterns to see whether they were following their medications as prescribed. And this time the follow-up was almost 5 years. And then what we learned here is those patients that took their hydroxychloroquine as prescribed, they had a 39% lower risk of developing type 2 diabetes. So there is a strong link between lupus and type 2 diabetes because lupus leads to insulin resistance. And actually diabetes is more frequent among people with lupus compared to people without lupus. So, so this is essentially the pathway for that prior study where again, taking hydroxychloroquine as prescribed confers this additional protective effect on a known complication of lupus, which is type 2 diabetes. So I'm actually really proud to share that in 2021, Arthritis Care and Research, which is the journals where we published this work, actually listed their most talked about research. And our study on adherence to antimalarials and type 2 diabetes was the top 6. And this is huge considering that we are talking about research across all different types of arthritis. So not just lupus. So to be top 6 of the most talked about articles in 2021 is a big accomplishment. And we didn't stop there. The study that we showed that taking antimalarials as prescribed also has a mortality benefit that was in the top 16. So I think this really just goes to show the impact and the practical implications and applications of the research that we do, particularly with finding these reasons to support and encourage patients to take their medications as prescribed. So here are the take-home messages from this talk. So there are many reasons that make taking medications a challenge, particularly those like hydroxychloroquine that is intended to be of chronic use. So I know patients worry about cost, patients worry about side effects, and there's also the need to understand how the drug works. However, there are strong benefits of taking medications as prescribed. So these are direct benefits. So this is, the direct impact on lupus in terms of the disease control, which translates into survival benefit. And there's also indirect benefits, which is the protection from comorbidities and complications of lupus, such as type 2 diabetes, which was shown. So I encourage you to please, if you are having any challenges with taking any medications, to speak with your doctor, your nurse, and also your pharmacist and how they can support you with taking your medications. And I thank you all for this opportunity. And I want to thank BC Lupus Society for the invitation to present on the symposium. And congratulations on another symposium. And kudos to you for creating these forums to bring research, to bring care to lupus patients. And I wish everybody a good day. Thank you.